and welcome to the first episode of DiEMCafe. My name is Manuela Collarella. I am the co-coordinator of Dublin DiEM25 Dublin DSC. And here we are with Emma Justin. Is it correct?
Absolutely.
She will introduce herself. I'll just say a few words about the DiEMCafe format. This is the first of a series of episodes with DiEM members from different countries to discuss how the COVID crisis is impacting the everyday life and the economy of the different countries. What kind of social measure the different government has taken, and what are the differences, what area of vulnerability there are in the different parts of Europe, to try to see, to have a bigger picture of how things are working at European level at the moment. We start today with Ireland and France. Now I give the floor to Emma.
Thank you, Manuela. The coffee cup we have,
Yes.
a great one. I'm Emma. I live in Paris. I'm a member of the DSC Paris one and member of the French NC National Collective. I was a candidate for DiEM25 last year during the European elections. And I'm first of all, I would like to thank you very much, Manuela, for this initiative, because for me it's a symbol really of DiEM. DiEM has hard to get Europeans closer together, and much of the time, issues within the European Union are based on the fact that the European neighbors don't know each other too well. And through your initiative, I think we're going to learn a lot about each other, about the different systems, and how we can improve things based on what we learn from each other. And I find that really, really great that you started the DiEMCafe. Thank you.
That's exactly the goal, because I and other members in our DC, we firmly believe that despite the conflict at European level about the plan for joint recovery, we need to unite the Europeans first. And in order to do that, we need to know more of what's going on in the different countries, especially in this difficult time. Speaking of which, how is going in France? How is the situation there?
It's a very, very strange situation, because we are just coming out of the confinement. Yesterday was actually the first weekend outside of the confinement after pretty much 2 months, because the confinement started here on the 17th of March. And we were kind of released on the 11th of May. So not completely, it goes step by step. But it's a first new step or stage towards our freedom in a way. But it's also the time where we can see what has gone right and what has gone wrong, and maybe we're going to talk about that. How are things going in Ireland on your side?
Well, today is the first day of the first phase of easing of the restriction. It starts precisely today. It should be a long plan. It's a 5-step plan that should last until August. The Irish government is going very, very slow, very gradually. It seems like it reached the condition for at least they say that they can reach the requested condition from the World Health Organization of testing 100,000 people a week. There has been some controversy, some conflict between the health department in the government and the emergency task force, because the emergency task force was the government was asking for this number, but the people in charge of the health system was saying, we don't have the infrastructure, we cannot reach that number, it's impossible for them. Now the government is ensuring that from next week they are reaching that point, which is a key point, because to control the epidemics, you need to know what the real numbers are during the process. There should be an app, and they are working on it together with Google and Apple, which a lot of people don't like very much, but they don't have disclosed much details about how it should work. So we will see. In general, this crisis has brought up a lot of weak points of the Irish public services infrastructure, because historically, comparing to the rest of Europe, of continental Europe, Ireland has not a big infrastructure in terms of healthcare system, has not a universal healthcare system, has a two-tier system. There was no public childcare, and all this overlapped with the COVID crisis, creating all sorts of problems that we maybe will see later. How has gone the management of the general crisis? How was the impact in terms of numbers there in France?
I mean, we've paid a very high price during this crisis. I mean, France has around 67 million inhabitants. And we are reaching now over 28,000 dead persons and around 150,000 people contaminated. Those are the official numbers, but no one knows actually whether what the official numbers contain, because in the first stage, people dying outside of hospitals were not calculated into those figures. Now, we hope that the figures are more accurate. But yesterday we had again around 500 people dying, so it's far from over. We still have in some regions, around Paris, the east part of France, the Bourgogne, a lot more patients actually than we have beds in the hospitals. So it's still an issue. France is no longer sending patients outside of France, which was the case during the crisis because we didn't have enough infrastructure. Switzerland, Luxembourg, Germany took patients. It's no longer the case. But in terms of ranking, for example, we come just after the UK, I mean, Belgium, Italy, Spain, and the UK, with about like 40 deaths per 100,000 inhabitants, which is actually pretty high and probably higher than in Ireland, I assume.
But how quick was the response from the government at the beginning of this?
The response has been very slow. We don't know. Actually, we are finding out more and more, and journalists are finding more and more that the government has probably been informed very early and probably by end of 2019 already. But we had two political issues at that time. One was the fact that the neoliberal government we are having right now wanted to pass a very important law on pensions, restricting the rules on pensions. That's one thing. It was a big issue for the government, and they didn't want to jeopardize it by, talking about other issues. The second one was the fact that we were about to have municipal elections in France in 36,000 city, towns, and villages, with 2 rounds, and the first round being on the 15th of March. That as well, the government didn't want to jeopardize, to the point that the government decided that the first part of the elections would take place on the 15th of March, against the advice of medical advisors, actually. And at the same time, they send potentially 47 million citizens to the voting stations. But they were also telling people, older people, pregnant women, or people being ill, to stay home and not to go to the polling stations, which shows that they had, they were conscious of the situation, but they still decided that it was less important than the political issues at this very moment. And we really paid the price for it. A lot of people who've worked in the polling stations on that weekend, some mayors died or were contaminated. And a lot of people also didn't go to vote, of course, because they were scared. And we didn't have any masks or hand sanitizers or anything at that time. So, you know, it scared people. And in a way, this first round wasn't far from very democratic, because it stopped a lot of people to go voting. So the reaction was very slow for those very political issues.
Yeah, we have a sort of political crisis overlapping the COVID crisis as well, because we had the election just before the starting of COVID crisis, and there were ongoing negotiations for the formation of the new government, which were totally frozen for the COVID crisis. And now, so what we have now is a sort of temporary government that is going on to, so there is also a problem of political legitimization. They don't have as a government that was going to end. So there are ongoing negotiations between the two main parties. They are taking time and discussion if the Green Party should take a place in it or not, or going into a new election in the middle of this. And you can imagine how this is
difficult.
In terms of number for as concern for what concern Ireland, this is of course a smaller country than France. There are 4.9 million of inhabitants, so all the numbers must be considered on this scale. At the moment, there are around 24,000 contaminated persons from the start of the emergency. Of these, 7,000 are in the healthcare sector. So there's a big problem of contagious in the healthcare sector, in the residential care for the elderly, and also in some factories. So far, the price of human life paid to this epidemics is 1,500 people. And in terms of newly contaminated, the number are now not that bad. The peak is gone. Ireland succeeded to flatten the curve, as now a familiar sentence that we all know. So it's around 60 new cases a day. And 10 deaths in the last 24 hours, which is not of course, every death is a tragedy, but in the big picture, unfortunately, we need to do this kind of consideration, is not doing bad. So it's not going bad. So it's understandable that they are going to ease some restriction now. But the problem is that, as again, there are overlapping issues from precedent issues that now are creating some problem in the easing phase. In Ireland, since the 90s, for a number of political reasons, working rights have been weakened very much. So the right to unionize, the right to ask to the court to enforce certain decision to the employers, the way how health and safety is managed, that is mostly based by consent, by no sanction, and so on. Now, in the middle of epidemics, means that the inspectors have the power of doing announced inspection, for example, or to impose sanction. This is creating a situation where the government has made a protocol to go back to work, a protocol about health and safety, about how employers should organize the workplace. I don't want to say to ensure safety, because we all know that it's not possible 100% to be realistic, but to reduce the risk as much as it's possible. And a lot of employers are not implementing it. And there are no tools at the moment to make it possible. So the unions are making pressure. The unions and also some elected representatives from the opposition are making pressure to demand this. But of course, this faced a strong opposition of a system that has a strong resistance to making positions to private companies, to the free market, that generally is considered the biggest priority from the Irish establishment. So the situation now is there are around 12 clusters in meat packing industry, with around 500 workers infected, and this is just an example of how these of the consequences of this situation. So I would say that the COVID crisis let emerge in the different countries all the contradictions that were already in place before. How is going about the? Now we talk about easing the restriction a little bit now there. How is going in terms of social measures, social impact there in France?
I mean, to come back to what you just said, I mean, in France, we are also seeing the consequences of political decisions which have been taken in the past years. Before the COVID crisis actually even started, the public hospitals in France had been on strike for a full year already. Still working, obviously, but demonstrating, asking for more financial and human resources. You must know, for example, that 25% of the doctor positions in public hospitals are not filled. The salaries are very low. Doctors starting at the emergency room, for example, starts with a salary of 1,650 euros per month after having studied 8 years and working more than 50 hours a week. So it's compared to I don't know, a lot of, you know, I would say non-risky jobs in banks or insurance companies, for example. It's very low paid and a lot more hours. So the hospital was already in a very, very bad state in France. Everyone knew it. DiEM joined a lot of demonstrations in the past year, supporting the hospitals in Paris, for example, but also in other cities. In the past 10 years, the austerity savings in relation to hospitals amounted to around 12 billion euros. So you can imagine that it was, you know, when the crisis started, it became a real disaster. That's the reason why, you know, we had not enough hospital beds. We had to send patients abroad. And even in terms of, you know, medical protective clothing, you know, the hospitals had nothing. So, and the government actually didn't offer much either. So that, for example, we saw, you know, announcements by the hospital requesting, you know, industrial companies to send industrial trash bags so that they can have protective clothing made of trash bags, or haircutters to send the gloves, you know, or you know, people to make masks for them. It's a disastrous situation, which is really the result of the past 10 years of neoliberal decisions from three different governments, but actually following the same, you know, the same approach. Exactly. We had you know, right wing. Then Hollande, which people hoped it would be more social oriented, but it was not. Macron was at that time already finance minister. And so over a period of 10 years, we had actually, a huge austerity in, at least in public services. And we are paying the price now for it. Now, the easement of the confinement on the 11th of May came under the pressure of the employers, who started to say, oh, people need to come back to work. And for people to come back to work, their children had to go back to school. So the first measure of this government was to reopen schools, but for small children from 3 months to 12 years, recognizing also through that and keeping universities and colleges closed, which is a kind of recognition that, you know, going back to school or to university is dangerous, or at least might be risky, but that's under the pressure of the employers. Small children who cannot stay alone at home have to be sent back to school, against the advice of the medical council of the government, against, you know, the advice of the teachers and parents, but that has been done. But with such measures, security measures, that it doesn't actually work very well, because, for example, each child is supposed to have 4 square meters around himself, which in the small classrooms allows only 5 kids at the same time, where in a class we have between 25 and 30 children usually. So it's a kind of, you know, start under the political and economical pressure, but without really the measures allowing, you know, the disease to completely disappear, if possible, and the security to be actually guaranteed. And that is something which shocked a bit people who clearly understood that this new start, people during the confinement have hoped that we would have a new world after the confinement, and people are realizing that actually the old world is going to continue, and that is something which is indeed painful for the population, and especially for the citizens who've lost some members of their family.
Yeah, yeah, yeah. We kind of have some similarities of differences here. We too had paid a high price to austerity. As many people know, Ireland had to bail out his banks, and it's in a strong debt position with the European Bank. And because of this, in the last years, very, very terrible cuts have been done to the public sector, healthcare in particular. And the healthcare system was already in a crisis before this crisis. There was a trolley crisis, people waiting in the emergency department for 20 hours before being treated, for example. Long waiting list for consultant visit, both in the public and in the private sector. Just to say that private sector don't always everything. During the emergency, there's been some sort of takeover by the Irish state of the private sector, let's say. So now Ireland is trying for the first time some sort of one-tier system. But this has been done paying a huge price that many are criticizing. The government is saying that this deal is a no-profit deal, but many are questioning because other countries have made similar deals, and comparing the prices, Ireland is definitely on a bigger scale. So, as always happening in Ireland, in terms of insurance, in terms of private healthcare, in terms of many sector, there's the feeling that a sort of oligopoly is making profit from the current situation. Yes, and in general, the austerity cuts have determined the situation where, at the beginning of this crisis, the system was in a very, very bad place, understaffed, with no big resources, with no big infrastructure. Then, during the emergency, a big effort was done. Which is, of course, important, and it was also the result of the bigger effort from the healthcare workers. A lot of people have been called back to work, people that had left the profession, of people who had emigrated. They have been praised as heroes. It would be nice to remember that when the emergency will be finished, to defend these jobs, because we needed more of doctors, more of nurses, even before. So this would be the occasion, and it's already starting to demand a proper universal healthcare system, and to demand job stability for these people that have come back to their country to risk their life, and deserve to be treated properly from now on. In terms of the school that you mentioned, two relevant things. The Living Cert, which is the high school diploma, let's say, the high school degree that to access the university, has been cancelled. because of the difficulty of doing that in person, respecting social distancing. And this has created a lot of discussion, because from the results of the living cert is decided which faculty you can access, in which university you can go, because there is a certain, let's say, level of prestigious that is very different from university to university, but still what the society perceives, then reality sometimes is different. And there is a lot of criticism, because the exam has been substituted by some sort of predictive grades made from the teachers. But they are still doing school profiling, which means that they are reserving certain quota for the most prestigious schools. Because this is also this is probably not very clear from people that can listen us from outside of Ireland. Generally, the private school, the most prestigious schools, ensure also the most prestigious places in the most prestigious university. So this, and this of course is seen from many commentators as a sort of perpetuation of the class system of the country. And this could have been the opportunity to open the access to students that have good grades, but maybe don't come from the right school. And of course, the present system, the present establishment immediately moved to defend himself, to defend the status quo, to not open this access at all. So even in the education, there is public education in Ireland. There is no public childcare, which is different. But still there is big differences in the kind of access that certain school can guarantee you. This is the same in every country, that certain school guarantee you a better access, a better success in the work life. But this is the system here on this side is particularly rigid, I have to say. In terms of the childcare, an interesting thing was that, as I say, there is no public childcare in the sense there are no public kindergarten managed and paid by the state, but the state provide some benefits to the family to pay private childcare. What happened during the crisis there was that even here, all universities and childcare services and schools were closed, but there was the necessity of some childcare for the frontline workers.
Yes, absolutely.
So the government promised that there was coming a scheme for that they should have provide some help in that. They announced it 3 or 4 times. It's coming. Now we are doing that. First, they proposed to give some benefits to pay babysitters, but of course this was a risk for the babysitter to go into the houses of people who are on the front line. Then they had a very interesting proposal about paying the partner of the person working in the healthcare, which was considered very outdated way, because of course, what if the other person has a job as well? What if I am a single mom? You cannot think of a model of family that is the same for everybody, So that was not exactly the proper way to respond this. Then they asked to the private childcare providers to provide this service, and the scheme didn't was not possible to implement the scheme because only a few providers subscribed the proposal from the government because of insurance issue, because apparently there is not an insurance company that want to insure the teachers working with the children of frontline workers.
No.
So this is another demonstration that not having strong public services makes you weak, especially in times of difficulties. Because if you had a public infrastructure, you could have done something. You could have opened at least some school on a smaller scale. You know, you would have had the infrastructure to organize something. But if you rely only on private players, of course, they are not obliged. So this is the results. Talking about the economical measures from the different countries. What was the response of the French government on that term?
So I would say they responded in two main ways. The first one is the fact that companies which couldn't work, or because they were not considered essential during the confinement, only food stores could remain open. And really essential services like electricity, water companies, this type of services needed on a daily basis. The other companies got the opportunity, but most of them were larger companies, to have a kind of a partial unemployment scheme, under which the state would pay directly to the companies, or would reimburse, let's say, to the companies 84% of the salaries of the workers, 84% of the salaries before income tax, to the companies. So a lot of companies took this opportunity and it avoided, of course, to fire a lot of people. The government says that during the confinement, probably 11.4 million employees enjoyed this scheme, which is quite a large number per se. The problem, of course, is that it's not going on for a long while now. So post June 2nd, this benefit is going to be restricted. Up to now, the parents also could get it, even if the company was working, if they had to stay home to take care of their children. Now, post June 2nd, since the small children are deemed to go back to school, the parents will not have this benefit anymore. And the companies will no longer have the opportunity to ask for this scheme as a collective scheme, meaning, saying all my employees should enjoy this scheme. It's going to be an individual measure, employee by employee. The company will have to prove that this very employee cannot come to the factory because would be too close to another person, or so on. I don't know how the state is going to control that, because over the years, the labor inspectors were in charge of coming to the workplaces to check whether the rules, the security rules and so on are respected. The number of those people has been reduced drastically. So the state actually has made sure that the state can no longer really control what happens in private companies. So I don't know how it's going to be, de facto. We don't know how. And the problem with this is also that the government has a double speech. On one side, the government says, please try to refrain from taking public transports because, of course, it's more risky. Try to work from home and keep working from home if possible, and so on and so on. But on the other side, other ministers are coming to the television to tell people you have to go back to work. So it's a kind of, double speech which people resent, of course. And it was clear that between, in the balance between the health of citizens and the economical life, the second is more important to the government. It's also very clear when the press found out that companies paying out dividends, for example, to the shareholders, and huge amounts right now, because it's that time of the year where companies pay their dividends in France, those companies would still enjoy the benefit of this partial unemployment for their employees, despite the fact that they clearly had the means to pay them if they had such amounts to be given to the shareholders. So in a way, the citizens are also a bit upset that they will have to pay taxes, of course, to cover afterwards this large amount of partial unemployment benefits, while private companies still receive this money while paying out huge amounts to their shareholders. So you see the type of measures which have been taken, and the unbalanced way those measures have been put in place.
What about did you have any discussion, any debate in France about the state supporting of not company who has their legal registration in tax haven? Because I'm originally from Italy, and this is going on. This is a very harsh discussion in Italy at the moment.
Yeah, we had this discussion, and it was extremely disappointing, in a sense that the government first said companies paying dividends to shareholders would not be bailed out, but would still be entitled to this partial unemployment benefit for the employees. So, and then the finance minister came to the parliament, and it was a vote in favor of excluding the companies having their registered office, or a subsidiary having a registered office in tax havens. That was actually agreed upon. The minister came to a press conference to announce that. And in the same afternoon, they tracked back and they said that it's not going to apply. So it's, there's a clear way what decisions are being taken by this government, neoliberal government, in all regards. There is at the same time a double speech, and the actions actually are louder than the words or the promises, I would say, and it always go unfortunately in the same direction. And we see it also through the way the state is helping companies in general. because the state is being very generous with companies. For example, private companies are allowed to defer the payment of their taxes, of their rent, of loans due to banks. The state has declared that the state is going to be guarantor for loans to private companies for an aggregate amount of 300 billion euros. I don't know what else. Yeah, the state also guaranteed that they would help renegotiating, loan repayment schedules to banks for private companies. But in the meantime, all those measures have not been taken symmetrically for the benefit of citizens. For example, citizens will still have to pay the rent. They will still have to pay their income tax on time. They will still pay, all their bills. So what is being done for the private companies is not being done for the citizens, where it would cost less to the state to cover and help the citizens than the private companies, because lots of them actually don't really have the means to continue without the help of the state. I don't know how it is in Ireland.
There are some similarities. Again, there has been two main measures. One is the temporary wage subsidy scheme, because again, since let's say the labor law is quite flexible. When the pandemic exploded, it was very, very fast for the company to lay off their workers. It can be laid off in 24 hours in Ireland immediately. So the government had to provide a scheme, because in 24 hours, where the lockdown went in, there were thousands of people put in layoff from their companies. So the immediate emergency response was this temporary wage subsidy scheme that will last for all the emergency period. Then, after that, they implemented also the sorry, I made confusion. The first measure was the COVID pandemic unemployment payment. There was a payment for the pandemic and will last for the emergency measure. They implemented the temporary wage subsidy scheme that is similar to what the government has done in France. There is about paying 70% of the salary to the workers, to make, in a certain sense, possible that the workers could find their job back at the end of the emergency. And of course, the employer is free to top up that 70% if it's possible for them, or not. But as you were saying, there are many, many areas of vulnerability to left behind from this social protection. For example, the COVID pandemic unemployment payment, it's 350 per week, which, depending from which country in Europe you are listening us, it can sound like a very high subsidy. But if you consider that the cost of life here is very high, and Dublin is currently one of the most expensive cities in Europe, especially for accommodation. There was a huge housing crisis. There still is a huge housing crisis going on in Dublin. There are 10,000 people homeless. So for a lot of people, considering the level of the price of the rent here, the average rent in Dublin is 2,000 euro at the moment. This subsidy is not enough to pay the rent. So what happened? A lot of low-paid workers, especially migrants, also EU migrants, talking for Italians that I know that maybe are in the food sector, working as barista, as waiters, things like that, had to run to go back to Italy in the middle of epidemics because they could not afford to make a living with this. It sounds like a high amount of money, but it's not enough to survive in Dublin, considering the current cost of life. The rents were frozen, but this means that if I was not able to pay the rent during the emergency, I will be in the arrears of 3 months at the end of the emergency. And this means that thousands, and I'm saying hundreds of thousands of people, could be at risk of ending up in the middle of the streets in a few days. So there are housing activists that are considering a rent strike or other forms of pressure, because, as you said, as the private companies have been helped, also the citizens need to be helped. A sort of amnesty or something like that for rents, for bills, for mortgages, because of course rent and mortgages are connected. We don't speak about the big vulture fund, but the small landlords. It often is the case that the rent that you pay is the mortgage that is going to be paid. So all the different segments of the society must to sit down and make an agreement about how to get out of this situation, because about current data, unemployment rate, considering those that are under the subsidy at the moment, went from 5% to 28%. Can you imagine? In a small country this, it means that 1/3 of the workforce is not working, and many companies are shutting down permanently, are not going back. Debenhams, which is a chain of shopping center from the UK, has closed permanently their Irish branch, and the workers are at the moment protesting for their rights, for having some sort of economic support after that. And we are talking about 1,500 people, just to make you an example. A big impact have been hit in the tourism and hospitality sector, in the aviation, which is a big problem as well. Good for the environment from one side, but still we need to give a support and an answer to all the people that is losing their job, So that's one of the situation, and the problematic.
And maybe also, sorry, because we spoke about the employed persons, but I mean, there is also something which is not really very often mentioned by the politicians, at least in France, is the fact that we believe that between 17 and 20% are people working in the underground industry economy. I mean, whether it's people who are not declared to the tax authorities and social security authorities, or whether it's illegal drug deal, all kind of. But there is a large portion in France, a large portion of the population which is living off the underground economy.
Not only in France.
No, not only in France.
I think it's a universal issue that there is a big part of society in every European country that does not show up in the official numbers for whatever reason. for whatever reason. Maybe I'm an illegal migrant, maybe I'm exploited because I don't have a contract. I'm a worker, but I don't have a contract. This is very common in Italy, especially in the south, unfortunately. And
those people, those people,
there are not many numbers on that. Yeah.
But unfortunately, the state didn't provide anything for those people, and they are out there. It's right now in France a huge issue. The soup kitchens are actually totally overwhelmed, especially because the Macron government and the government before restricted the benefits for unemployed people. So lots of people actually were excluded from the unemployment benefits. And for a lot of family, sending their kids to school would mean also, because the school here goes until 4:30 in the afternoon, that the kids would have a hot meal for lunch, and sometimes the only meal during the day. With schools closed, this disappeared. In the meantime, the supermarkets and the government didn't do anything against it. The supermarkets increased the prices for food. The government didn't prohibit that. And lots of families cannot afford to feed their children anymore. And nothing is done, to help really. In the meantime, the associations helping the poorest and the more fragile cities in the French population have less money, because the first measure taken by the Macron government was to cut the wealth tax, to just eliminate the wealth tax. And under the wealth tax, people, to decrease their tax burden, would actually spend money to charities. That disappeared as well, so that a lot of associations taking care of the more fragile part of the population are not only overwhelmed, but they don't have the resources either. So this is a really, in the big scheme, this crisis has, as you mentioned rightly, Manuela, has emphasized something which was already in this society in terms of neoliberal measures, more and more taken by the government. It has actually reinforced the inequalities, the poverty in this country, and it's an absolute disaster. And of course, a lot of people are hoping for a new world, more solidarity, more greener, because without cars we discovered that it was really pleasant. Actually, a lot of people would hope for a program like the one DiEM has. Let's see how far we can go with it.
In terms of areas of vulnerability, as you were saying, emphasizing pre-existing issues. Another big issue that I want to mention is the outbreak in direct provision. Direct provision is a very specific institution here in Ireland. It's the specific accommodation provided for asylum seekers that are generally put in a community structure like hostels and stuff like that, with no facility to cook on their own, with only common space to eat the food provided by the manager of the place. And they are generally overcrowded, terrible living conditions, like family of 6, 8 sharing the same room, where isolation is impossible. And the organizations from the asylum seeker were raising the alarm from day one, saying to the Irish government, there will be an outbreak in those places, because it's obvious that it will going to happen. And of course, now they are dealing with outbreak in places where isolation is impossible. And again, this has been a problem that has been going on for years, and the establishment has refused to do anything about that. So that's another way of how this crisis is emphasizing things that were already on the ground. As you said, one of the reasons that pushed me to organize this series is to let emerge these vulnerabilities and to stress the point that we need a common plan of joint recovery. The weapons, the tools that the national states have to face this are very, very limited because of European rules, and in general because these are bigger problems than the national scale. You cannot solve. Ireland can come up with a better plan ever and solve and bring the epidemics to zero. But if in the rest of Europe, even if we are an island, we cannot live in the illusion that this will not come back in a few days. It's impossible. We are all interconnected, and we need to get out of this together. That's why the plan. That's why I'm in DiEM, and why I believe that the proposals of DiEM for a joint recovery, which is not based on austerity, is the best solution for that. And still, the government are already talking about who's going to pay the bill of all this. So we need to be very vigilant and very active, because different governments are already subtly mentioning that we borrowed too much, and now will come the price of all this. So what they are already preparing austerity for the many and socialism for the few, and we need to contrast this and push for a European response that is not regressive, but is for everybody, really everybody in this continent. So I think we come to the end of our episode today. It's about 1 p.m. We covered the lunch break of our listeners. And follow us, because there will be other episodes. The next one will be in a couple of weeks about Italy and Germany. So it could be another interesting match.
Absolutely.
Emma, I wish you all the best, and I wish France all the best, and to all Europe.
You too, Manuela. And I wish also all the best to DiEMCafe, because I think that's a great initiative to know more about what happens in the different countries and how we can also help each other and inspire each other. That's very important.
Yeah.
Thanks a lot.
Let's see what happens. Thank you so much, Emma. Bye.
Thank you. Bye.